Kayla Blackman, registered nurse, certified inpatient obstetrical nurse, and certified child passenger safety technician. In this video, we will share tips regarding newborn reminders for hospital discharge and some newborn care and safety tips. When you deliver at an Infirmary Health facility, you will receive newborn discharge instructions. Also, you will receive an outline of your baby's delivery, physical assessment, and exams during the hospital stay to share with your baby's healthcare provider. All babies should have a follow-up visit within 24 to 72 hours from your baby's discharge from the hospital. Your baby's nurse will need to know the plan for this follow-up visit. You will need to schedule this follow-up appointment before leaving the hospital and notify your nurse when you have done so. The birth certificate clerk will provide step-by-step instructions on how to apply and receive your baby's birth certificate and Social Security card by mail.
Hand washing is so important. It sounds basic, but your baby does not have the immunity that you have. Everyone needs to wash their hands before holding the baby. It's important to limit visitors, especially if you know they have been sick. It's okay to say, please don't come right now. Don't let others kiss your baby. Even if they don't feel or look sick, it is not safe. Bacteria and viruses can be spread days before symptom onset.
Always support your baby's head and neck. When moving the baby, support the head and neck with one hand and the bottom and the thighs with the other hand. Hold your baby close to your body or in a cradle position. Use soft touches and strokes. Remind younger siblings to be gentle.
Crying is a baby's way of communicating. It can mean I'm hungry, I'm wet, I want to be held. Some babies have crying episodes, especially if they are overstimulated. You can try to calm your baby through skin to skin, talking softly, singing or playing some soothing music. Evaluate why your baby could be crying and take action. Feed, burp, or change the diaper. If your baby is persistently crying for more than 3 hours, or if you're concerned about your baby, trust your instincts and contact your baby's healthcare professional right away. If you feel yourself becoming stressed or angry, place your baby safely in a crib or a safe sleep area on their back and take a short 5 to 10 minute break. Call a friend or a family member and ask for help if you cannot calm down enough to safely care for your baby.
Sudden infant death syndrome, commonly known as SIDS, is the sudden death of a healthy infant less than 1 year of age without a known cause. Babies always need to sleep alone, on their back, and in their own safe sleep area, like a crib or a bassinet. Babies need to sleep on a firm surface in their crib or bassinet. No soft pillows, comforters, or newborn loungers. American Academy of Pediatrics recommends your baby sleep in a crib, bassinet, or portable play yard with a firm, flat mattress and a fitted sheet. Place the bassinet or safe sleep area in your room for the first 6 months before placing them in their own room. Co-sleeping is not recommended as it may increase the risk of SIDS. Do not put blankets, pillows, or bumper pads or stuffed animals in the crib or bassinet. Avoid allowing your infant to sleep in an infant swing or a car seat unless the vehicle is moving. Dress your baby in a lightweight sleeper and keep the room temperature comfortable for a lightly clothed adult. In cooler months, layer your baby in fitted clothing. Sleep sacks, wearable blankets are preferred over blankets or other coverings that keep your baby warm. Loose blankets are not recommended. When done correctly, swaddling can be an effective technique to help calm infants and promote sleep. But you need to make sure that you place your baby on their back every time you put them to sleep and stop swaddling as soon as your baby shows signs of trying to roll over. For more information on how to swaddle, please visit healthychildren.org. Your newborn may sleep 14 to 18 hours a day. Infants wake up around the clock for feedings. Getting used to that as a new parent can be challenging. Be patient as baby grows. They will develop daytime activity and nighttime rest patterns. During the day, keep the house bright when baby's sleeping. At night, start a bedtime routine. Dim the lights, speak softly, and limit distractions during nighttime feedings. Lay your baby down when he or she has become drowsy, and keep the room quiet so baby will return to sleep.
Prior to your delivery, we would encourage you to install the infant car seat and get it checked by a certified child passenger safety technician. Our car seat safety technicians offer car seat fairs periodically throughout the year. Follow our social pages for upcoming dates. In addition, some of the local fire stations can also check your car seat installation. Call and make sure their certified tech is there before you make the trip. The chest clip needs to be placed at armpit level. Tighten the harness straps until you can no longer pinch excess fabric at the collarbone. Infant car seats should be installed to go in the rear-facing position. In the state of Alabama, they are not allowed to forward face until their first birthday. However, the National Highway Traffic and Safety Administration recommends that they continue to rear face as long as possible. Never put bulky clothing or blankets under the car seat belts. In the winter months, place jackets or blankets over the belts, not underneath. Do not add additional car seat inserts, mirrors, or toys attached to the car seat unless they are made by your car seat manufacturer for that car seat.
Newborns should be fed on demand, 8 to 12 times in a 24-hour period roughly. It is important to watch for hunger cues and feed your baby at the first sign of hunger. Now is not the time to establish a schedule. Watch the baby and not the clock. Remember, crying is a late sign of hunger. Your baby still needs to be awakened at night for those nighttime feedings. Your pediatrician will tell you when it is safe to stop nighttime feedings. Breast milk is the perfect food for baby. The American Academy of Pediatrics endorses breastfeeding exclusively for the first 6 months of life. Although breastfeeding is natural, it is a learned skill for both you and baby. Feed your baby on demand, aiming for at least 8 to 12 feeds in a 24-hour period. Cluster feeding is normal, especially at night. Once your milk is fully in, completely empty one breast before moving to the next, alternating breast with feeds. Wait until breastfeeding is well established to introduce a pacifier, around 3 to 4 weeks. Responding to your baby's earliest feeding cues will make things easier for you and baby. Some early cues include wriggling movements, rooting, sticking out the tongue, making small noises, or sucking on their hands. Signs that your baby is getting enough milk include giving cues for feeding, feeding at least 8 to 12 times in a 24-hour period, being satisfied after their feedings, and sleeping for 1 to 2 hours. Weight gain, an appropriate number of wet and dirty diapers. Always store your milk according to safe milk storage guidelines. You will receive these guidelines in your baby news booklet. If you are having to pump and feed baby expressed breast milk, it is recommended to pace bottle feed, as this will help to preserve baby's ability to latch at the breast in the future. Paced bottle feeding reduces overfeeding, reflux, ear infections, and choking. To pace bottle feed, you want to hold your baby semi-upright, prop them at a 45-degree angle with their head and neck aligned, supporting their head in the crook of your arm. You can even tuck a pillow under your arm for some extra support. Give their mouth a little tickle for a good latch. Encourage your baby to open their mouth by gently tickling her lip with your finger, then placing the nipple into the mouth. Hold the bottle horizontally, tipping it just so slightly. Hold the bottle parallel to the ground. When you're ready to start feeding, you want to tilt it upwards just slightly. This will encourage your baby to work for the milk and prevent too much liquid from flowing out at once. Let your baby sip for a bit, then give her a break. Give your baby a chance to drink for 20 to 30 seconds, then lower the bottle so it's parallel to the ground again. This will give her a short break, and you're going to repeat this until she is satisfied, paying attention to her fullness cues. The entire feeding session will likely take between 15 to 30 minutes, and you'll know that your baby has had enough when she doesn't go back for more after a break or she turns away from the bottle. Let your baby take the lead. It won't be long before your baby starts deciding when to take drinking breaks on her own. When she does, go with the flow.
Changing diapers frequently is a key step in preventing diaper rash and keeping your baby comfortable. If your diaper has a wetness indicator, you may look at that to see if the baby is wet. It does not, however, show signs if your baby's had a bowel movement. To change your baby, have a clean diaper and wipes ready to go. Never leave your baby unattended on a changing table or elevated surface. If your baby shows signs of diaper rash, lightly cover the entire rash with a diaper rash ointment, as advised by your baby's healthcare provider. Keeping the area clean, dry, and doing diaper changes often will help. Let your baby go diaperless on occasion at this time. If the rash does not go away after a few days, contact your healthcare provider. If you have a little girl, always wipe from front to back. This reduces the chance of getting bacteria into her urethra, where the pee comes out. In the first few days, you may notice she has vaginal discharge. It may even be white, clear, or pink tinged. This is normal. If you have a boy, make sure you are wiping and cleaning under all the crevices. If you are not planning on circumcising, or you are having your circumcision done at a different facility, there is no need to retract the baby's foreskin until baby is much older. If you did receive a circumcision while in the hospital, your baby will most likely come back to your room with a petroleum gauze covering the penis. Your nurse will tell you when to remove this. Once removed, you may notice his penis will look red and swollen, and you may notice a yellow discharge on the top of the penis as it starts to heal. Do not try and wipe this off. This can be very normal in the first few weeks after a circumcision. You will need to start placing petroleum jelly inside the baby's diaper to prevent any sticking. To clean the penis, you will need to use clean, warm water and dribble it over the circumcised area. No baby wipes until the site is completely healed, around 14 days. If the circumcision site is actively bleeding or looks infected, which is pus, red streaking down to the scrotum, or foul-smelling discharge, call your pediatrician right away. It will be important to keep up with how often your baby is going to the bathroom. Your pediatrician will be asking. This is how we make sure baby is getting enough to eat and is adequately hydrated. In the first few days, baby will need as many wets and dirty diapers as days of life.
Babies do not need baths every day at first. Just a few times a week at the sink is fine. Until the umbilical cord falls off, you will just do sponge baths and check to see with your healthcare professional to see when they are comfortable with you doing a tub bath. Make sure to wipe in all of the crevices and wrinkles and use either a soft washcloth or cotton balls over their eyes, wiping from in to out. Only uncover the part of the body you are washing so your newborn can stay warm. When it's time to do a full bath, be sure you are using an appropriate tub. Only 1 to 3 inches of water is needed. Make sure the water is not too hot by testing on the inside of your wrist. Make sure the room is not too cold, no ceiling fans are on. Babies lose heat easily. Their hands and feet become blue. Their skin may have lacy pattern of pink and pale areas. Both are signs that baby is cold. Always dry your newborn right after a bath and do skin to skin or put them in their clothes to prevent them from getting too cold. Talk or sing to your baby during their bath to promote the feelings of trust. Always use a mild or baby-friendly soap and make sure to rinse them very well. Never leave your baby unattended during a sponge bath or a tub bath. Have all of your supplies ready to go. The umbilical cord will heal, dry up, and eventually fall off over 1 to 2 weeks. Let it fall off on its own, never pull on the cord. Keep it clean and dry. Sponge baths only until the cord site has completely healed. It also may be helpful to fold the diaper under the cord site, as to prevent urine from getting the cord wet during this time. A few drops of blood from the umbilical cord, it may be normal. However, you need to notify your pediatrician if the cord is actively bleeding, more than 1 to 2 drops, has drainage, a foul odor, warmth, or redness. Baby's skin can be dry, cracking, maybe even flaky. Over the next few weeks, it will begin to look more normal. It's just their skin getting adjusted to being outside in the air. Oils and lotions are not needed during this time, even if it looks like they have a rash. Your healthcare professional will tell you when it is appropriate to use scent-free lotions and oil. Never use any powder products such as baby powder. Your baby may have small red bumps on some parts of their body. This is called the newborn rash. You may notice small white bumps around or on the nose and face, which is called milia. These will both go away on their own. Avoid picking these bumps as they can scar. Babies' nails can be quite long and sometimes sharp. Remember, they are still connected to the skin underneath. At first, it is safest to file baby's nails with a clean emery board while they are napping or in a relaxed state.
Some common reasons you may need to call your pediatrician or contact 911. Call your pediatrician if your baby has an under the arm temp of 99.3 degrees Fahrenheit or greater, or is less than 97.5 degrees Fahrenheit. Your baby has swelling or drainage from the eye, belly button, or circumcision site, will not stay awake for feedings or refuses 2 or more feedings in a row, vomits 2 full feedings in a 24-hour period, has a yellow tint to the skin, has fewer than 6 wet diapers in 24 hours after day 5 of life, does not have a bowel movement for more than 24 hours by 3 days of life, has diarrhea that is mostly water or stools that are almost white, stools that are bloody or hard to pass. If your baby's crying cannot be relieved after 3 hours of soothing, or the baby has white patches in their mouth that cannot be wiped away. Call 911 if your baby is breathing very fast, working hard to breathe, or stops breathing, has dusky, bluish skin, is lethargic and unusually difficult to arouse, has a bulging or sunken soft spot at the top of the head, or has a life-threatening emergency. You are now equipped with a parent's instinct. If you think something may be wrong, call your baby's healthcare provider.
Please refer to your baby's discharge information for more detailed instructions and tips for infant care and safety. We hope this video has been helpful. If you have any questions regarding further instruction on how to take care of yourself or baby, please discuss with your nurse or healthcare provider. We thank you for delivering with Infirmary Health, your first choice for healthcare in the Gulf Coast region.